Welcome to Needham School Spotlight. I'm Dan Gutekanst, Superintendent of Schools. Substance use and abuse is a reality in our community and sometimes in our schools. Joining me today for a conversation about what we are doing in the town and the schools to collaborate to prevent youth substance abuse are several folks. I'd like to introduce, first of all, Tom Denton, Needham Public Schools Director of Guidance, John Madelman, Needham Youth Services Director, Carol Reed from the Health Department, who also leads our Needham Youth Substance Abuse Prevention Coalition, Tim McDonald, the Director of Needham Public Health, Kathy Pinkham, our Director of Wellness, and also we have two students, Mark Walker and Nicole Luca, who are both members and leaders in SALSA. Nicole, what's SALSA?
SALSA stands for Students Advocating for Life Without Substance Abuse, and it's a club at the high school that focuses on substance prevention, and we go to Pollard to the 8th graders and we talk about drugs and alcohol and reasons to say no and ways to say no when anyone tries to peer pressure you into doing certain things you don't want, like drugs or alcohol.
Okay, well, we're going to talk a little bit more about the work that you're doing in our schools, so thank you for explaining that. You know, I thought I'd begin with the big picture, perhaps, Tim, as the Director of Public Health, sharing with us what's going on in our community and in our schools. We gather a lot of data. I know that Carol does as well, and in your work. Recently, we conducted a Metro West survey that shared information about what our students perceive are some of the issues. What were some of the results about substance use in the community and the schools?
So there's a number of pieces of information. We're very lucky as a community to be part of the Metro West Adolescent Health Survey, which has been administered every other fall by the Metro West Health Foundation. And it's a detailed survey that focuses on middle school and high school and looks at everything from substance use, stress, mental health, sleep, nutrition, dating behaviors. It's a wide-ranging look at the health of the youth in the Needham school system. It tells us a lot, and you know, the people around this table, or these tables, rely on the data that's provided there to help make decisions and help target programs. One of the things that I'm interested in from this year's data is the difference in the perception of risk between drunk driving and drug-impaired driving. So in the 2014 administration, the fall 2014 survey administration, 81% of Needham high schoolers thought that drunk driving or being the passenger in a car with someone who had been drinking was a bad idea. But only 53% thought the same if that driver or themselves had been drug impaired. So the messages, both at a local, state, and federal level, about the dangers of drunk driving have really penetrated the consciousness of today's youth. But there's a real difference between what they perceive as the risk of drunk driving and what they perceive as the risk of drug-impaired driving. So that was one of the things that really stood out for me. One of the other things, and I think it's a tribute to a number of the school and town departments, the students say in the high 80s, say they have a trusted figure that they could go to at school, that they would be comfortable sharing a problem with. And that's a protective factor, which is really important when you think about substance use or abuse, mental health conditions, or suicidal thoughts or actions. So having that protective factor in the Needham Public Schools is a real benefit. It helps protect our students from making those extreme decisions or feeling pressured into doing something that maybe they aren't sure they want to do.
Before we go any further, I know, John, that your work working with these families on all of these issues that really you just talked about and that everyone around the tables is focused on. We've been doing it for many years, and you've seen the survey results too. Is there any takeaway that you have from?
Well, there are a couple things to know. First of all, risk is a really important term, but we have to think of it from an adolescent point of view. The adolescent brain looks at risk differently. We used to think that they didn't see risk. Adolescents actually see risk, but they're more drawn to the reward. And actually the person doing the risky behavior does not see that behavior as risky. So we have to understand that so you can see where the adult brain and the adolescent brain collide, because we see it very differently. Also, we have to really think about the interplay of technology, in terms of access, kids knowing where to find drugs, kids being up 24/7, kids waking up to check their phones, social media, the impact of reading everyone else's filtered lives when you lead your own life unfiltered has a huge impact on all of these at-risk behaviors.
Carol, what are some of the takeaways from the Metro West survey result that your group and discussing and you've been talking about with parents and others?
What
what we have seen is that rates are decreasing locally, state, federally for alcohol, 30-day use, and binge drinking, which is a good sign. Yet marijuana is, in our last 214 survey, stayed quite stable, and that's concerning because in the focus groups we've done with youth, they talk freely about the lack of perception of risk and harm with marijuana, and we are committed to look at that type of access point in public health. Like we said, the risk and protective factors, educating youth and parents about the risk of harm with marijuana, and consistently reinforcing the risk of harm with alcohol and misuse of prescription drugs. So what adolescents will tell us is that the risk of certain substances in their perception needs to be adjusted. We have the science and we have the data, and young people are very smart and understand the science and want to hear that, and that's part of the work that SALSA does, and we appreciate that. When you look at the youth survey, yes, the numbers of students that are saying they're using substances is concerning, yet we look through the social norm lens and say the majority of Needham high school kids are not using substances in the last 30 days. So that's part of the work that we around this table are also trying to convey to parents, because it's concerning, and have our youth say that same thing.
Well, and I'm hoping if we have time we can get into some bit of a conversation. We're actually in a very interesting time right now because we have the governor just signed legislation 2 days ago about opioids, and some more screening in schools for students. And we have a ballot initiative about legalizing marijuana. And so we're in this weird time right now where as a culture, I think, and as a larger community, we're struggling with what is the right thing to do. And young people, I think, from our perspective, are in the crux of that. And how do we help them and go through that? And what are the right things to do? It is, some of it's very troubling to me, and yet maybe there's an opportunity to think about youth leadership even more strongly. Tom and Kathy, both your work in the schools is pretty significant in thinking about these substance abuse issues, both in the classroom and wellness and health classes, and also from a guidance perspective in helping families and students. What are some of the things that you're seeing, Tom, in the school, and then maybe Kathy, what are some of the things we're trying to do in the classroom to mitigate some of these concerns?
Sure. So one of the, there's a number of areas of concern that have already been mentioned. The one that I want to talk about is mental health and substance abuse, and that one of the things that we've been able to dig into the data and we're finding is that students who struggle with mental health issues have a higher usage of both drugs and alcohol. And so it's while on one level students may be self-medicating in order to try to help themselves feel better when they're anxious or depressed, it also appears that it's making those conditions worse. So it's really an important education piece for students to really understand that around mental health and about effective treatment is, even though in the short run you may feel a little better or at least numb yourself so you're not feeling as distressed, that in the long run you're actually furthering your difficulty in terms of a mental health issue. And that also goes, stress is also, really correlated. We looked at students who are experiencing very high levels of stress are also students who are reporting, higher levels of drug and alcohol use too. And so while something that you may be doing to try to help you with an initial problem that you're having in the long run just makes that problem worse and worse. And I think that's a very, very important thing for all of us to be aware of, and for certainly in the counseling and guidance to really help students see, because it's quite concerning.
Well, and unfortunately, we're in a culture where, for a generation at least, the solution was, take this pill and things will control your ADD, or we will control your anxiety, or we will control this or that. And I hope we can eventually get to a place where it's not a matter of trying to control one's behavior, perhaps, but maybe acknowledge what one's abilities are and feelings are, so that we can use those, leverage those to help with learning. I know I was happy to hear the other day that more and more doctors are trying to prescribe exercise for their patients, and not a painkiller or some prescription. And then the problem in the cities is that there are fewer places to exercise, gyms, for example. So, I mean, it'd be great if we had an increase in the number of gyms available, and running paths, and less jailhouses and other things. But maybe that's another discussion. The student perspective, I think, is pretty critical in this, Nicole and Mark. And I know you represent your peers, and I guess I'd like to ask a little bit about what is your perspective, and we'll start with you, Mark, on what SALSA does and what you think the big issues are for this community.
Well, mainly what SALSA does is, we do a wide variety of things. One of them mainly being that we visit 8th grade health classes. We sit down with those kids and we tell them ways to say no to drugs and alcohol, but we also kind of bring the realization to them that not everybody in the high school drinks or uses drugs, because funny enough, that's a lot of kids' perceptions when they're in middle school. So they get nervous going to high school thinking, oh, I won't be accepted unless I do one of these things. And on top of it all, we also just tell them what the high school's about. So when we talk to the kids in the middle school, it's not, our main focus is ways to say no to alcohol and drugs, but we also focus on other aspects of the high school, clubs and whatnot. But we also hold different events, like fifth quarters one we've been doing for a bit, where after home football games, kids have a place to go party and enjoy something to do after the game without having to worry about going to someone's house and being pressured to do something. So we do a few events like that, a coffee house, which we've done this year and the year before, where kids can go listen to live music, look at art, and have some snacks. That's what we do.
Yeah, I think it's really important to tear down that misconceptions the middle schooler have, but I think we should implement what we teach at a younger age, because I feel like when they're in 8th grade, they already know what they want to do, what the choices they will make. And I've talked to my brother who's in 7th grade, and he was saying, yes, like there's a lot of 7th graders who I heard are smoking, and that's really sad to hear. And I think that if we started at 6th grade, that would be a great start for them to see and enter with a new view.
Well, I know you talked about teaching. I want to ask Kathy in a moment to talk about what's going on in the classroom. I know when I talk to parents, parents whose oldest child is in 5th grade or 6th grade, they, on the one hand, don't want to hear about this because they think it's later on in college or maybe senior year in high school they have to worry about. But I think you're right on that not that we have to frighten people, because that's not. I really like, Mark, how you said that we're trying to introduce them to what's going on at the high school, all the great things, because that's how you get connected and have a good time and grow and learn and develop a passion for something. But I think some parents need to be aware that it's a conversation with their child, and using young people like you to have a conversation with them is powerful. And actually, you're great role models. So I think we can start earlier than some parents probably would wish, and also try to do it in a way that it's not frightening, which sounds like you're not doing that. We'll get back to this, but Kathy, what's happening in the classroom? What are we trying to do? Because there's facts and information and conversation teachers are having with students.
So there's two approaches we take. One is knowledge and the other is skill building. And we start with our health program in grade 6. We go to 7, 8. We start with tobacco. We move on to alcohol in 7th grade. We get into other drugs in 8th grade. And then when we look at the high school, we go back to the data to see where the use is happening. And there's a jump between 9 and 10th in use, and there's a jump between 11 and 12 in use. So we place our health classes prior to right in those spots. We have a 9th grade health class and a 10th grade health class that address a variety of the issues that have been brought up, address decision making. So we talk a little bit about the teenage brain and how our kids need to take a little pause between the stimulus, do I want to do this, do I want to take this drug or have this drink, and their response to it. We give them information. We introduce Alcohol EDU, which is an online educational program about alcohol, and my understanding is it will include marijuana next year. This year it's sponsored
This is something that students do on their own, in class?
They do it in class. They
Okay.
do it in class. This year it was sponsored by the Newton Wellesley Hospital, which was a great thing to have. And next year we're going to be able to bring it into our own budget, so it'll continue on for our kids. But it happens in class so that the kids can have the experience, but then have an opportunity with the teacher to process the experience and the information that they receive. Throughout the whole health program, whether we're talking about substance use or relationships or any topic that kids have to make decisions about, we teach skills, so decision-making skills, how to analyze what consequences are going to be if they choose to do something. So it's a combination between content knowledge and skill building that we hope kids can go away with.
And that's all of that's happening pretty much, would you say, regarding substance curriculum, 6th grade? Are we?
6th, we start with tobacco.
6th and then up.
7th, 8th, 9th, and 11th.
Okay.
Where we really hone in on the topics.
I wanted to hear a little bit about some of the resources that we have available for families, John and Tom. But before that, it seems to me, Tim, that the news about opioids is, I mean, we're hearing it all the time. It's a problem. What's happening locally in Needham with opioids? Is it? Are we immune from what's going on out in the community?
Not quite. Opioids are a topic that are in the news. One of the things that potentially is a misconception is that, opioid addiction, especially at the point where it might lead to overdose, is often but not always a result of heroin. But most people who use heroin start with other drugs. And in many instances, people who have a habit of misusing prescription drugs may have been prescribed medication for a very legitimate purpose after a surgery or an operation, and found themselves addicted, and then resorted to a pattern of trying to steal them from friends and loved ones. One of the things that Needham is very fortunate, both our police and fire department carry nasal naloxone, which is known as Narcan, which is an opioid overdose reversal medication. There have been, and you're going to have to forgive me a little bit on the numbers, 9 in the last 12 to 18 months, 18 months I think, 9 overdoses that have been reversed, all successfully in Needham.
By our public safety folks,
yes,
who administered Narcan.
Yes, by either police or fire.
Wow.
So that's a troubling number for people.
Excuse me, and save their lives.
Yes.
Okay.
So that's a troubling number if you're in the community. It certainly speaks well to our public safety that they are both trained and equipped to respond in this way. One of the things that I think is potentially a comfort to parents of Needham school children is that the school nurses in the Needham public schools have been trained and each have nasal naloxone and Narcan kit. Whether that would be used if a student potentially overdosed, which would obviously be a terrible thing, but also there's a number of parents that are on school grounds, there's drivers who are delivering supplies, there's a number of reasons why it's appropriate, and it shows sort of how the community is trying to make sure there are resources and techniques and training available all throughout the community. So I think that's a positive thing that Needham has done proactively to try to address the concerns that people have about opioids and the opioid epidemic. The conversation will unfold. So I guess I am weaving this in about marijuana, and when I think about the marijuana, and I'm not referring to the medical marijuana dispensary, kind of a different topic in many ways. Maybe not entirely, but certainly a different topic, and something this community is trying to administer and manage. But when I think about recreational marijuana and the possibility of edibles and things that little
the children can get hold of it, it is concerning. And I think there is some research out there saying that it does do damage to a developing brain, and so we're going to have to really wrestle with that as a community and as a state as the next several months go on. I wanted to ask you, John, you all the time, families come in, students come in or are referred to you who have some really significant issues, and I know, Tom, you can comment on this as well, in the schoolhouse. How is the town prepared to assist families who are dealing with some of these
Well, Needham
issues?
has a lot of resources, both within the school, Needham Youth Services, the public health department, in the community. We have a phenomenal number of therapists in town. That said, the high school population is growing, so while statistically the percentages are decreasing in some areas, the actual numbers are increasing. And adolescents are supposed to make mistakes. That's what it's all about. And some of those mistakes are fine and benign. And some of those mistakes are really painful, and some actually can take a life. We know from the Youth Risk Behavior Survey, close to 200 kids have self-injured. We know about 175 kids have seriously considered suicide. These are startling numbers, even for all of us who work with these all the time. So while the resources are great, the problems are more complicated, and keeping up with them is really hard. We talk about building resilience in kids. That's great. But how can we make kids who are as young as 4th, 5th, 6th grade resilient to some of the challenges they have? And when they make a mistake, they feel really badly about themselves. And when they feel shameful, they're going to be going to harmful behaviors. And I like to teach kids about self-generosity. Like, it's okay that you didn't do well in this paper. It's okay you didn't make this team. It's okay you're not the lead in the school play. So kids who can understand about self-generosity are happier and healthy kids, and happier and healthier kids involve themselves to lesser degrees in at-risk behaviors.
Tom, in the schoolhouse, how do you direct some of the resources or help the counselors decide, here's a student in need, and this is how we'll respond? Or
as John said, there's this is a very caring community, and so we use youth services, talk to Carol often about students who are struggling with substance abuse issues. Within the schools, we spend a lot of time kind of meeting with counselors around students that we're worried about, students we're concerned, devoting counseling sessions, resources to them, reaching out to parents. We're very fortunate in this town that we have, through the William James College, we have Interface, which is paid for by Newton Wells, the Deaconess in town, and also the Shapiro Foundation, which provides mental health service referrals to Needham families and Needham individuals. So you really have to pay attention to this on many levels. There needs to be kind of early detection and monitoring of how kids are doing. Counseling needs to be available, connecting with parents, education, and with all of us working together, we can hopefully head off both teach resiliency skills, but also head off some of the possible more tragic, and provide services and treatment earlier in the process. And it's really having students be as involved as they are around substance abuse is very, very important. A number of years ago, when I became director, we didn't have a student organization, and I think students were really, really uncertain as to whether they could trust adults, whether they could work with adults around substance abuse and issues. I think there was a lot of concern about consequences and getting in trouble, and so it's very heartening to me to see students, more and more students coming forward and saying, we see this as a problem. Can we deal with this in a kind of non-discipline, but a more treatment?
Well, and it's in a proactive way that is really powerful. Carol, I just in the actually a little bit of time that we have left, the Needham Coalition for Youth Substance Abuse Prevention has been supporting SALSA. And what are some of the other things this year that are going on with the coalition?
As we hear here, this is an issue that's a community issue. We work with a commitment to 12 stakeholders in the community: school, youth serving, parents, faith-based organizations, businesses, fraternal organizations, public health, police. So we work to break down the barriers between all of us as stakeholders to see what we can do to support youth and families. And we're doing policy changes to basically impact access and availability to substances, like Needham was so proactive in doing years ago with tobacco. So limiting access and availability to shift the community norm and to have people understand that this substance use traditionally has been a stigma for people to talk about. And we want to work to mitigate the stigma for mental health and substance abuse. That's the barrier often for youth and families to reach out and ask for help. So by getting the community together around the table through the coalition, we are breaking down those barriers and using what prevention science tells us can impact at the individual level and the family level, school, and community.
Well, it's incredibly powerful to have the community come together, and I'm glad you mentioned the fraternal organizations like Needham Exchange, the faith-based groups. I mean, it's the community truly coming together, and we're fortunate in Needham. Mark and Nicole, I'm going to have you end. We really have just a bit of time, but Mark and Nicole, I'm going to throw this at you. What else? And you're graduating this year, Mark. You have one more year with us, right?
Yes, I do.
Good. What else should we be thinking about, real quickly, as you think about your experience in Needham, Mark? What else do we need to be paying attention to regarding this topic?
You know, that's honestly a difficult question to answer. I feel like there should be more, and we do this a lot, being able to listen to the students and whatnot, but I feel like if we allowed some students to be able to be those avenues of help, to have like a student that kids could go to and be like, hey, here's what's going on, and that student could advocate for that person, maybe make the interaction a little more comfortable for the student looking to be heard.
Okay, so student advocacy, anything you would add to that?
I think we need to focus on the students' mental health. There's many problems, and many students have come up to me saying that they struggle with depression and anxiety, and they thought that smoking weed would be the only way to help them, but they see that there's guidance counselors out here who will listen to them and they have more friends. And we need to focus and try to help out those students to show them that they should not be resorting to these harmful substances.
Well, it sounds like empowering young people to really work with us to take charge of their lives is the message and the takeaway I've had. I appreciate this conversation this morning, and thank you very much for the really good work that's going on that the community is supporting. Thanks.